Cheshire East is a wonderful place to live, work and visit. The Cheshire East Partnership is a collection of organisations that have come together to plan how best to deliver services to meet the needs of everyone. Our vision is to improve the health and well-being of local communities, helping people to live longer and healthier lives. By creating and delivering safe, integrated and sustainable services, we will meet people's needs and make the best use of the money, buildings, equipment and people we have. Well-being comes from everyone taking ownership of what they can do for themselves and their community, with support available when and where it is needed. Good health and well-being come from the environment, wealth and society as a whole. Education, employment, housing, relationships, families, safety, food and air are among the many things that affect our health, happiness and well-being, for better or worse. We want children and young people to get the best start in life and be ready for school. We want people to live well and independently for longer, and we want older people to be independent for as long as possible. 384,000 people live in Cheshire East, which has agriculture and industry, countryside, villages, market towns and urban centres. Services should be designed for local needs. For instance, what is needed and works for people in Crewe is likely to be different to Macclesfield. Our population will change in the coming years, as we expect HS2 to bring more working-age families to the area. At the same time, we expect the number of older people in the area to grow. HS2 will develop business and new opportunities for regeneration and employment, and also new demands on public services. In general, the health and well-being of our residents is good, but there are differences between different areas. For example, a baby born in the Crewe East ward can expect to live to 73. This is 12.5 years less than a boy born in Chelford. This is unfair and avoidable. The main causes of death and illness in Cheshire East are cancer, heart disease and respiratory illnesses. 1 in 10 people die too early because of breathing conditions. This is better than the average for the country, but worse when compared to similar councils. Differences in the levels of ill health and well-being are often linked to big differences in other aspects of quality of life. We will use our knowledge, power and resources to reduce these gaps. Often, people need a number of different specialists and teams, called multidisciplinary teams, who wrap care around each person. There are 8 care communities which provide similar services to reflect specific local needs. We will help people to find the right services, support their families and carers, and use the different professionals working in therapies, pharmacies, social care and primary care. We want local communities to be supportive and to look out for each other. We want people to have the life skills and education they need to thrive, along with access to good cultural, leisure and recreational facilities. There are over 20,000 people working to provide public services. It is difficult to hire people with the right skills and to keep them. To overcome our difficulty recruiting care workers, GPs, nurses and consultants, we will develop services that can be delivered by other health and social care professionals. We are focusing on recruitment, training and retention, and we want to employ more local people, particularly young people. We will connect all health and care services together and invest in systems and equipment to help different organisations to share information. Staff will have quick and easy access to the information they need, and will also reduce our reliance on paper that is inefficient and can delay care. We are collaborating across Cheshire and Merseyside to ensure a single set of digital standards that are reliable, cost-effective and consistent. My Care View is connecting people with tools to help them live better and access the right care. The digital initiative can access over 3,000 community groups, find smartphone apps to help people manage their condition, and access hospital and GP records. Where possible, we will help people live healthier and independent lives for longer, enable people to stay out of hospital, deliver more services at home or closer to home, reduce the demand on all hospital services, and increase the range and choice of care provided in people's homes, in local clinics and in primary care centres. Cheshire East receives £700 million, but spends £750 million. We must find ways to providing the best possible care using the resources that we have. Our vision is to enable people to live well for longer, to live independently, and to enjoy the place where they live. We want to keep people well and healthy, rather than just try to fix things when they go wrong. We all want to be healthier, to spend more time with loved ones, and to enjoy the interests that we share. We want to work with everyone to make life better for us all. We will do this because we care.